Murphy. I'm the chapter leader of the UFT Retired Teachers chapter, and you saw on the screen before we began the other main leaders of this chapter, starting with Michael Mulgrew, of course, and then Leroy Barr, who's been very instrumental in helping us with making these presentations work. Deborah Penny, who's TRS trustee for the UFT and also liaison to the retirees. Jeff Sorkin, the executive director of the Welfare Fund, and Vince Gaglione, who has been chairing the RTC Health Coverage Committee. Last I checked, we had 12,232 people registered. I see that we now have, looks like with my eyes here, 6,100 folks on, and I know people will be joining us as they do. Some were signing on even at the last meeting. This is a series of informational meetings in which we're trying to get as much information out as we can to our members about this new Medicare Advantage Plus plan. We had a well-received meeting on August 30th, and the speakers who were here before on that date are many going to be back here again to make presentations. We have another meeting, a general membership meeting of the UFT Retired Chapter on October 13th, and we've cleared the decks on that. The only major issue that's going to be presented then again is going to be this health plan. So we know that folks are looking to sign up, allow it to be signed up, or opt out if that's their choice, and we'll be commenting on the timing of that as we go further. As this meeting will progress, here's how it's going to happen. Michael Mulgrew is going to speak first. He's going to say a few words on this, and then we're going to hear from Jeff Sorkin, the executive director of the Welfare Fund, and then I guess it'll come back to me and I'll introduce Kim Parker at that point, who we heard and was well received in August. And then we'll turn it over, after she makes a presentation for about a half an hour, to Vince Gaglione and his committee. Now, I know in the past that we have had multiple people ask questions, but because this is so close, Vince thought, and we agreed, that we would cut down those who asked the questions to just 3 to efficiently get to the questions and get the answers. So also please note, Patricia, do you want to put up on the screen the website page as I'm speaking just before I introduce Michael? We have been working with Facebook and with our website to try to get information out as possible. We've created this brand new website page section. Scroll it down, Pat, so people can see what's down beneath, if you will. And when Vince comes on, he will speak a little more extensively about what's on there. It's all the information as we get it. It is the most up-to-date. This meeting is being recorded as it was August 30th, and when the meeting is concluded, we will send tonight out a link so everybody can listen again if they wish, or if they didn't hear the meeting. If you have some friends who couldn't get on or weren't able to, just please understand that we're trying to get information out as much as possible. So having said that, I'd like to introduce the president of the UFT, Michael Mulgrew. Michael?
Michael, you're muted.
Good afternoon, Tom, and good afternoon to everybody on this call. And I want to thank Tom and his team for all the work they've been doing, as well as the Retiree Healthcare Committee and all that they have been doing. This is, we're sitting here dealing with a couple issues at the UFT as we're getting ready for Monday, where we have to open our schools, and we're waiting, and hopefully we'll be able to open all our schools safely as we deal with these vaccine mandates. And I'm thinking about all the processes we've been through and the challenges we've been through, but since this pandemic has hit us, and I think about all the different things that have been out there. crazy information, facts that are wrong and everything else. And I thought about this process that we're in right now with this Medicare Advantage, the name we all hate and what we know we can't change, because we are not anything like a traditional Medicare Advantage program. And I think about before the pandemic, when we had a meeting at the MLC and the city came into us and there was an alarming spike in healthcare costs in across the board, our retiree healthcare plan, everywhere else. And that's really been what this process has been about. It's been about taking control. It's been about changing the paradigm of how we go about making sure that we're getting the best healthcare for ourselves, that's in service, and our retiree members, and really starting to tackle this out of control healthcare cost crisis that the entire country is facing. And I remember at that point in time, we were about 2 months before the pandemic, where they said that we're going to have to put co-payments on the retiree healthcare, because if not, they were looking at doing something very substantial in terms of saying we have to even start thinking about putting premiums on their table. And at that moment in time, the MLC was really said, listen, we'll do what needs to be done for right now, but we're not playing in this on this field anymore under these rules. We're done. We're absolutely done, because we're basically marching to a place where it's just going to be more and more money out of our own pockets. It's going to be premiums that every year are going to be percentages put on it over and over again. And not just for our retirees, but also for our in-service folks. And that's really where this process began, about saying, all right, we need to learn more about this. We can't just be relying on consultants. We have to really dig into this and learn a lot about everything. And the first one I said we have to stabilize firstly is our retiree health care. Next year we have to tackle our in-service health care. We have to stabilize our retiree health care. We cannot be sitting here 3 years from now and dealing with massive premiums, new administration coming in at that point. That's what we were thinking 2 years ago. And then the pandemic hits. And thankfully, not thankfully, but because of the pandemic, we went to the city, we went to the insurance companies. We said, we have to push those premiums off right now, the co-payments. We have to push the co-payments off because we're now in a pandemic. Everybody agreed. But then throughout that, we said, we have to continue to do the work of this process. We cannot continue the city's position was, we cannot continue to absorb 20% of all the healthcare costs, which we are paying for, of the retirees, not just of the UFT, but of the entire city retiree workforce. That was a big, and we saw the costs escalating at a rapid rate. And it didn't matter, this administration be out of here. We knew the next administration coming in, this would be the first thing they'd put on the table. You all know this, you've lived through how many times we've had a crisis in our healthcare coverages. So it really was about that, about how do we get smarter, but also at the same time, do what we've always done as a union, start taking more control over this entire process, believing in each other that if we have real information and we have constant communication and we figure out a way to have leverage and a way to get things changed if we're not getting what we were promised, we have all of those things in place, then we know we can take control and get to a better result. And that's the process we're in right now. This process, like every other thing in the United States, every other thing in the city at this point, a lot of different facts that aren't facts out there. But for me and for us and for the MLC, it became, all right, city, we're going to do something. But we're not going to do what you want. We're going to figure out how to do a healthcare plan that nobody else in the United States has done. And our folks figured out very clearly that how do we get that 20% back? How do we get reimbursed by the federal government for that 20%? And that meant we had to go into the name we hate, a Medicare Advantage system. But we weren't going into a Medicare Advantage program like anyone else's. We wanted to design our own. And we wanted it to make sure that we get everything we currently have, and in this process, figure out how to get even more. And that's been our process throughout. And just like, the OLR didn't meet its you didn't get the informational stuff out on time. The minute we got it, we put it out to you. But at the same time, we said, you know what? You have to extend the deadline now. You have to extend the deadline because people need time to get real information to absorb it. Our folks are very knowledgeable, and they will make the decision that best suits them. And then constant changes in terms of folks. Mom says, I'm not inside plan. We know most doctors don't know what plans they're inside. And, it's for us, it's like, how do we get the information that you will know that they're in the plan or out of the plan? You can still go to them, but let us make the people we're paying, the insurance carriers, the people who won this bid, let them do the work of dealing with the doctors and their offices, because they're really dealing with their billing departments. They're not dealing with the doctors. Let them do that work. And that's what I mean by that constant information that built into this system that we're headed towards. We built in that we get to have a healthcare committee. That healthcare committee will have representatives at the MLC in the healthcare committee that will be dealing with the alliance group that had taken on the bid. And if something isn't going right, you're the ones who tell us, we will go get it fixed. Because what we have inside of that contract, I can say to you, meets everything we've had before plus more. But if somebody's not getting what is inside of that contract, we all need to know from you guys, and then we'll go do our work and make sure you get that. And that's really how we set this system up, so that we can make sure we have real input control. We can look at the costs ourselves. We don't have to, we'll do it with the city. But it's, again, UFT, other unions, because this is this MLC issue, but it's really about us saying, you know what, other unions may want to be involved with this process, but for us, it's not a may. We will be involved with this process. And knowing that 3 years from now, that there is no premiums on the table, because now the city has said, if you can do this, and if we can get the 20% back, we will absorb. We know that $600 million that we were going to spend now is going to go into your welfare fund, the city's welfare fund, which serves us and pays for our benefits. And what does the city get out of that? They get a fixed cost. They know what their cost is for the next 3 years. And that's what is a great comfort to somebody running a city. This is the cost. It's not going to go up. This is it. But now it's really about us doing something, that people have not done across this country. We've designed our own Advantage program. We've designed to meet the needs of our retirees and all retirees of New York City. And once again, we don't have issues with taking on the responsibility of holding people who have contracts with us responsible for what we know we are now entitled. And that's what this is about. So we want to get you the information you need. I thank you for all the communications that we get all the time. Some of them not so nice. Most of them really just about asking questions, and that's why I love this union. Where New York is first and foremost is a nice way to put it. So, but I love that about all of us. So for us, just keep that information going. We've been on top of, we gotten right in the very beginning. 90% of every doctor that we use is already inside of that network. So fine, let's try to get the other 10% in, even though it doesn't matter if they're in the network or not. You can go in and you have any doctor with Medicare. And we've been holding the company's feet to the fire about lowering that percentage of that 10%. And they've been doing a good job on that. A lot of city retirees, though, go to some really out-of-the-way doctors, which I know they're trying hard to find them. Google searching certain parts of the country where there isn't like a town for 500 miles, it's kind of hard to find a doctor, but they're working on that. And that's what we're already doing, is sitting with them, doing all of the things they have to do. Communication process could be done much better. The proper website, we found out that, if you Google and try to look at this, you could probably land up on 3 different websites that none of them are the right ones. We want to streamline that, and they're working on getting that completely set up, having real information for you to bring to your doctor. But again, I cannot stress this enough. If you ask your doctor, because I've tried this myself, they don't know what networks. their billing departments do. Because I asked one of my doctors, he says, no, I'm not in that. I went back, I looked into the network, and guess what? Of course, he was in it. He had no clue. So we're going to make sure that we're educating and talking to all of the physicians that we know we are currently using as a retiree group, and we're going to make sure they're aware of it. But again, it doesn't matter if they're in or out. You can use those physicians. So this is a journey as always. Just like our in-service folks right now are going through a journey, and they never thought. I don't think that if you asked us 10, 15 years ago, would we design a whole new healthcare system so that we could get the federal reimbursement we should be getting and at the same time take more and more control of our services, we probably would have said no. But you know what? I think what we'll see is this was the smart way to go, because we can get the service, we can save money, we can actually use those savings to support our other benefits that we all get through the welfare fund, and at the same time stop anyone from coming into City Hall and saying, you know what, I want retirement premiums, I don't want to pay that cost anymore. We've been through that. We have won that battle every time, and we're going to win it again. So again, I thank you all, to Tom and to the committee, and to all of you for what you've done. And to Kim Parker, I have, you guys send me very nice emails about her. That's very nice. So Kim, just for you to know, I get nice emails about you. She's going to do a presentation today of what's up, where we're at right now, you know, giving us an update on things that are about to change as we move forward. But again, let me assure you, we are here to all take care of each other. And sometimes that change is scary, and there's a lot of bad misinformation out there, and lawsuits fly all the time, you know. But I know we did our process with integrity, and I know that what we're trying to accomplish, what we have in writing right now, is what we set out to accomplish. And now it just comes down to us doing what we've always done. UFT, standing there together and making sure that we hold those people who we have given business to, we hold them responsible for us getting what we deserve and what we are paying for. So thank you all very much. And Jeff, I'm going to leave it to you. I know Jeff Salkin loves this process, because he knows part of this is the welfare funds get a little support, but at the same time, he knows it's always about how do we try to increase our service for all of our members.
Well, thank you, Michael. And we're going to go to Jeff because he wanted the executive director of the welfare fund to show the overlapping and the difference and the special character of our welfare fund as we integrate this. Jeff.
Thank you very much, Tom, and thank you everybody for joining us today. I think it's important that we get quality information out to all of you, and we've been receiving several questions about our welfare fund benefits. Namely, how are our welfare fund benefits going to be impacted by this new plan? And it's simple, and I wanted you to hear it directly from me. The fact of the matter is our welfare fund benefits are not changing with this new plan. Regardless of what New York City health plan you stay with, you will still be eligible for the optional rider reimbursement, our Medicare D catastrophic reimbursement, our dental benefits, our optical benefits, and our hearing aid benefits. Nothing is changing with the UFT welfare fund. Now, in addition to that, I just want to reaffirm our commitment to all of you, to help you, to assist you. I have to give a special thank you to the UFT Welfare Fund Member Services Department. We have fielded and assisted thousands of people with thousands of inquiries over the past few months. Keep them coming. Don't hesitate to reach out to us. It is our pleasure to serve you. Thank you. Enjoy the presentation, and back to you, Tom.
Thank you, Jeff. And it's a great pleasure to introduce Kim. She has been someone who presented not only to our committees, but August 30th, and as Michael mentioned, getting great feedback on her presentation. She has been experienced with Medicare Advantage business plans for 29 years, extensive experience with private sector, with public sector employees like the City of New York. And if I get her title correct here, she is the plan executive or the account executive for New York City Advantage Plus plan. I probably gobbled that, Kim, but you can ungarble it for me, and you and your colleagues who will be joining you in answering some questions after your presentation are most welcome, and we look forward to hearing from you. Kim?
Thank you, Tom. I really appreciate it. And you didn't garble it. You got my title right. If I could have Steve pull up the presentation deck.
Froze. It totally froze.
Do you want me to try to pull it up?
Yes, try to pull it up.
While we're waiting, I see that we have 7,500 participants on this meeting, so I don't know if the numbers matter in affecting things. So while we had 12,000 signed on, we're getting more. So there we go. Thank you.
Okay, does everyone see my screen correctly now?
Yes.
Okay, great. Well, first and foremost, I want to thank the UFT for this opportunity. Once again, I'm Kim Parker, and I'm from Empire Blue Cross Blue Shield, and I am ultimately the account executive that's responsible for managing the City of New York Medicare Advantage Plus plan on behalf of the City of New York and the City of New York retirees, which encompass all of you UFT retirees. Many of you may have heard my prior presentations, so it could be a good refresh for everybody. The goal of today is to really provide you with as much education as possible. And before I get into the presentation, I just want to remind everyone that we have 1 month, you still have 31 days to make your very important healthcare decision about your plan benefits for 2022. So I want everyone to take a step back and be mindful about the decision that you're going to make. Read all of the information, take your time, make an educated, informed decision in regards to your benefits. This is a very important decision for many people. It's very personal, and what might be good for one person may not be good for the other person. But I just want everyone to take their time. We still have plenty of time for you to make your decision in regards to going into the new plan or opting out. So just digest all of the information, and hopefully I'll be answering all of your questions today, everything that's top of mind. I'm going to try to weave in some of the most commonly asked questions that we've received over the past 2 months within the presentation. So you can move to the next slide. Oh, that's me. There we go. Today I'm going to be going over the comparison between traditional Medicare and how Medicare Advantage Plus plan works. I'll be going into the national provider access component. So this is probably the one area that has gotten the most questions. So I'll spend quite a bit of time talking about the providers that you'll have access to under the Medicare Advantage Plus plan. I'll review through some of the enhancements. These are the things that traditional Medicare does not cover that you will get under the new Medicare Advantage Plus plan. I'll go over a high-level comparison between the Medicare Advantage Plus plan and the Senior Care plan so that you can see how the two programs compare for 2022. We'll also be going over the prescription drug update. So my colleagues from the Alliance, from Emblem Health, will be going through the prescription portion of this presentation. And then at the very end, I'm actually going to do a demo of the Provider Finder tool to walk everyone through how that tool works so that you have the ability to look up your providers and confirm that they participate in the plan. And then we will open it up to the questions and answer session. Now for everyone, this is a high-level overview of how Medicare Advantage in general compares to original Medicare. And before I go into this, I just want to emphasize exactly what Michael Mulgrew said earlier. This is truly a customized plan that was developed specifically for the City of New York and City of New York retirees. So this is not a plan that is available on the open market for individuals. This was specifically created for the City of New York. It is a customized national PPO program, so retirees will have access to benefits no matter where you live in the United States or U.S. territories. And it is a national PPO plan that will provide access to all national providers that participate with Medicare. Now, currently today, you have your original Medicare, which is divided into two parts. Your Medicare Part A is your hospital benefit, and your Medicare Part B is your provider or professional portion of Medicare. In addition to Medicare Part A and Part B, you also have a supplemental or secondary coverage through senior care. Under the Medicare Advantage Plus plan, we are combining all of those pieces together into one program. And that creates a simplified experience for the member. So you are going to have one identification card. So you're no longer going to have your traditional Medicare card, your GHI card, and your Empire card. We combine all of those pieces together in one program. So you'll have one identification card. And what that also means is you're only going to receive one explanation of benefits. So when you have services done, you're no longer going to get an explanation of benefits from Medicare and then an explanation of benefits from GHI or an explanation of benefits from Empire. It will be combined, and it's one explanation of benefits through the New York City Medicare Advantage Plus plan. Now, since we're contracted with the federal government to administer your Medicare benefits, we're bound by Medicare rules. So we are required to cover everything that's covered under traditional Medicare today. So if it is a covered service under Medicare, it will be a covered service under the Medicare Advantage Plus plan. We follow the same Medicare coverage guidelines. We follow the same Medicare medical necessity guidelines that are in place with traditional Medicare. So once again, if it is a Medicare covered service today, it will be a service that's covered under the Medicare Advantage Plus program. Now, in addition to all of the services that we're required to cover under the Medicare benefits, we also add enhancements to the program. So the benefit program is going to include a whole host of additional programs and services that are not currently covered through traditional Medicare or the GHI Senior Care Plan. And just to call a few of them out, you'll have the Silver Sneakers free gym membership, there's a healthy meal benefit, as well as non-emergency transportation, which is a car service to and from your provider's offices. And I'll go into a little bit more detail about some of these enhancements later on in the presentation. You can move to the next slide. Oh, that's me again. Sorry. Probably one of the most important questions that has come up over the past 2 months is regarding providers. What providers will you have access to? And because this is a national PPO, members will have access to any Medicare participating provider across the country. And there's approximately 850,000 providers that participate with Medicare today. You will have access to all 850,000 of those providers. But what's very important to call out here is the fact that over 640,000 of those providers are actually in-network contracted providers with either Emblem Health, Empire, or any one of the other numerous Blue Cross Blue Shield plans across the country. So members will have access to in-network providers that are associated with any of the Blue Cross Blue Shield plans across the United States. So for example, if a retiree lives in Florida, those in-network contracted providers participate in the Blue Cross Blue Shield of Florida plan. If you live in New Jersey, those in-network contracted providers are part of Horizon Blue Cross Blue Shield. North Carolina, it's North Carolina Blue Cross Blue Shield. So members will have access to the entire Blue Cross Blue Shield association of in-network providers across the country. I do want to provide a very important announcement for all members regarding Memorial Sloan Kettering. As of 2 days ago, we received the signed contract from Memorial Sloan Kettering that they are now going to be an in-network participating provider in the plan, accepting the New York City Medicare Advantage Plus plan as of January 1st. So this is an incredibly important announcement that I wanted to share with all of the members. And it's not only the hospital, but it's also the affiliated physicians that participate with Memorial Sloan Kettering. We anticipate and hope to receive the signed contract from Hospital for Special Surgery within the next week or so. So we anticipate that should be forthcoming as well. As soon as we receive firm confirmation, I will be communicating that to the UFT leadership so that they can ensure that they disseminate that information out to all of the UFT retirees. I do want to emphasize the fact that, I focus in a lot on the in-network contracted providers. Over 90% of the providers that City of New York retirees are using today are actually in-network participating providers. So there is a very good chance that the doctor you're using today is an in-network contracted provider. And at the end of the presentation, I will be going through a demonstration of the provider finder tool so that you can see how you can look up your providers. Now, there are two easy ways that members can confirm if their providers are participating in the plan. The first and easiest way is to call the New York City Medicare Advantage call center, which is the call center that's open Monday through Friday, 8 a.m. to 9 p.m. Eastern Standard Time. And that number is 833-325-1190. A little piece of advice, if you're calling the Welcome Center, we do have periods of call spikes throughout the day. Best time to call the call center is after 5 p.m. towards the evening hours. That seems to be when the call volume goes down a little bit and calls can go through a little bit quicker. We also have the specific designated website that was created for the New York City Medicare Advantage Plus plan. And this is the empireblue.com/NYC-MA-plus website. And on that website, you'll have access to the Find Care tool. And when you search through the Find Care tool, you can look for providers. You'll need to know the provider's zip code or city and state where the doctor is located. And then you can search the provider by name. Just make sure you don't put doctor before the provider's name. You need to put the doctor's first name and full last name, and then you'll be able to search through the tool. The tool will have access to all of the providers that are in the network nationally, so you can look for providers in any state. Now, I wanted to just briefly go through some of the important enhancements that come along with the New York City Medicare Advantage Plus plan. I briefly talked about Silver Sneakers earlier, which is the free gym membership that members will have access to. There's over 16,000 Silver Sneakers gym locations that participate in the plan nationally. It is portable, so you can use a Silver Sneakers location here in New York. If you travel to another state, you can switch your Silver Sneakers location to that location in the other state that you're traveling to. There's also the non-emergency transportation benefit, which is 24 one-way trips to and from your doctor's appointments, pharmacy, or hospital visits. You'll want to coordinate this 48 hours before your doctor's appointment. Now, we have a concierge health guide customer service model that's in place to help support the City of New York retirees. And that concierge health guide can actually be the ones that help coordinate that non-emergency car service on your behalf. So the concierge health guide is really there not just to answer simple benefit questions or look up claims. They're really there to advocate on behalf of the member to make sure that the member gets the most out of the health plan. They're there to help assist you through this complex healthcare system. They'll even get on the phone and help schedule doctor's appointments on your behalf. We also have the telehealth medicine benefit through the Live Health Online application. So you can have a virtual doctor visit over your smartphone, tablet, or computer with a board-certified physician. There's also the healthy meal benefit. Post-discharge from the hospital, members will be eligible for up to 56 meals delivered to their home. You could also qualify for this benefit if you have an elevated A1C, you're diabetic, or your body mass index is a certain number. We also have the healthy pantry benefit, which is designed for members with certain chronic conditions, where through some dietary changes you can improve or help manage that chronic condition better. Members will get a shelf-stable pantry box delivered to their home each month, as well as a nutritional counseling session telephonically with a dietitian each month. We want to incentivize or reward members for doing their preventive and wellness screenings. So through the Wellness Rewards Program, retirees have the ability to earn gift cards every time you do your wellness or preventive screening. So when you do your annual physical, your health risk assessment, your colonoscopy, your mammography, you have the ability to earn gift cards for every time you do one of those preventive screenings. We also have the 24/7 nurse line that's there to assist members with assessing symptoms. So quite often, members will use the nurse line in the middle of the night when something happens and they want to run their symptoms by a medical professional. So this is staffed by registered nurses, and they'll help triage your conditions to tell you maybe this is something you need to get to the emergency room right away, or this may be something that can wait until the morning for you to see your own family physician. There's also worldwide emergency and urgent care covered under the program. And this is important because traditional Medicare does not cover you outside of the United States. So under the Medicare Advantage Plus plan, you will have coverage for urgent and emergency care anywhere in the world. We also have the Medicare Community Resource Support Team that's in place that helps connect members with the community resource program that's located right in your own neighborhood. A good example of a member that might use this is an Alzheimer's patient with a caregiver, and the caregiver may need assistance with finding help for respite care. So this community resource team will help connect that caregiver with the local support that's right in their own neighborhood. There's also routine foot care covered under the plan, not just for diabetics. So traditional Medicare does not cover routine foot care unless you're a diabetic. The Medicare Advantage Plus plan will include 12 routine foot care visits for all members. We also have the health and fitness tracker benefit, which is basically a Fitbit. Retirees will be able to get a free Fitbit every 2 years, as well as access all of the online tools that link to that Fitbit. So there's a whole host of additional benefits and enhancements that are included in the program that are really primarily designed to help members have better medical outcomes. So these services and programs are there to help members manage their chronic conditions better, as well as remind them to do all of their preventive and wellness screenings. So the ultimate goal is to have a member that's healthier and has better medical outcomes. This is a high-level benefit comparison between the GHI Senior Care Plan and the Medicare Advantage Plus plan. And I recognize that not every retiree is covered under the GHI Senior Care Plan. And on the Office of Labor Relations website, there is a side-by-side plan comparison for all of the other plans that the City of New York offers. So I encourage all retirees to go on to the Office of Labor Relations website or the link that's included on the UFT website, that it does include the side-by-side for all of the programs. But since the majority of the City of New York retirees are covered under senior care, this is why we include the side-by-side for the senior care. I do want to call out a few changes that are of note for 2022. The senior care plan is changing effective January 1st, 2022. So the plan will now have co-payments for provider visits. So whether you see your primary care physician or a specialist under the senior care plan, there will be a $15 copayment that members will have to pay for those visits. I also wanted to note that on this comparison, we're reflecting that Medicare Part B deductible of $203. That is the current 2021 Part B deductible. That will change in 2022. Medicare has not published what the new Part B deductible will be for 2022. So I just wanted to call that out, that your deductible under senior care will also be increasing slightly in 2022. So under the Medicare Advantage Plus plan, you will have a $253 deductible, and that's combined in or out of network. So members will be responsible for the first $253 of medical services. And then we also have an annual maximum out of pocket of $1,470. Now, the maximum out of pocket is comprised of everything that you pay out of your pocket in cost shares. So that $253 deductible comes off of that maximum out of pocket of $1,470. Your $300 inpatient hospital copayment comes off of that maximum out of pocket. All of your copayments that you pay throughout the course of the year count towards that annual maximum out of pocket. So this is your catastrophic cap. And once you reach that maximum out of pocket, there are no additional copayments that you as the member will have to pay. So this is your protection and your cap under the program. It's important to note that under the GHI Senior Care Plan, there is no maximum out of pocket. It's unlimited. And what that means is your costs can continue well above that $1,470. So your copayments and out of pocket just continues. You do not have a catastrophic protection in place under traditional Medicare and the GHI Senior Care Plan. Under your inpatient hospital care, the benefits are the same. It's the $300 copayment per admission with the $750 maximum per year for hospital copayments. Skilled nursing care is covered under both programs at a zero copayment for the full Medicare benefit period from days 1 through 100. Now, under the Medicare Advantage Plus plan, the primary care physician visit copayment will be a zero copayment. So for your primary care physician, you pay a zero copayment. For all of your specialist visits, it would be a $15 copayment. And that $15 copayment includes everything that's done in that one office visit. So everything that the doctor does within the one office visit is included for that $15 copayment. Now, if you see more than one specialist or you have different services done in the same day, it would be $15 for each separate office visit that you have. You have an emergency room copayment of $50. And under the Medicare Advantage Plus plan, if you're admitted into the hospital within 72 hours of that emergency room visit, that copayment will be waived. And we waive the copayment so the member is not subject to both an ER copay as well as an inpatient hospital copayment. Dialysis, whether it's a dialysis treatment on an outpatient basis or in your home, is covered at a zero copayment under both plans as well. Now, the next slide talks about the enhanced prescription drug plan that's offered through the city of New York for those retirees that don't receive their drug coverage through their union. So at this time, I'll turn it over to Diane DiGregorio to go over the prescription drug benefit plan.
Thank you, Kim. Good afternoon, everybody. I'm Diane DiGregorio. I'm with Emblem Health. Just wanted to take a couple of minutes to go over the prescription drug benefit. As Kim mentioned, there for members that are currently enrolled in the senior care program and that do not have prescription drug coverage through their union, they receive the drug coverage through Emblem Health, which everyone is known as the optional rider. For the members that are currently enrolled in senior care and are moving over to the MA program, there will be no change to you for your prescription drug program. Everything will be remain exactly the same. So if you're currently enrolled in senior care, you have the optional rider with Emblem Health, the GHI Enhanced PDP plan. The change, you will have the same exact coverage. You do not need to complete any forms. You will not be receiving a new ID card. You can continue to use your existing ID card. The formularies is exactly the same. Now, every year, Emblem Health does update the formulary. So the new formulary for 2022 will be posted to our website sometime this month. I think within the next couple of days, you will be able to access the new formulary on our website. You will continue to pay the 25% cost of the prescription drug coverage. The prescription drug, the prescription drug. The only changes that will be made is for their your true out-of-pocket costs, the troop. Now, currently your troop is $6,550. For 2022, that is going to be raised to $7,050. Note that this is something that is set by CMS. We do not determine this amount. This is based on CMS guidelines. For members, as Kim mentioned earlier, not everybody is enrolled in the senior care program. So for the members that are currently enrolled in another program, if you opt to go into the new MA program, you will too be automatically enrolled into this prescription drug plan. You do not need to complete any type of application if you currently receive prescription drugs through your Medicare program through the city of New York. You will automatically be enrolled in this program. A new ID card will be sent to you, and you will have the same exact benefits that all of our current senior care members have. If you opt out of the program and decide to stay with the program you are with now, you will continue to receive your prescription drugs through that program. So for example, if you're enrolled under the HIP VIP plan and you choose to opt out of the MA plan and stay with the HIP VIP plan, your prescription drug program will remain the same as you have right now. I think that's it, Kim. I think we can move on to the next slide.
Great, thank you, Diane. Oh, just wanted to call out the premium is going down.
Yes, and actually I have there's two things. One is that the premium is going down. Right now it's $150.30 for January 1. It will go down to $125. Also, for members that are not enrolled in the prescription drug program and have elected for whatever reason to be enrolled in an individual direct pay prescription drug program, you will no longer be able to stay in that program. Medicare requires that if you are enrolled in a group Medicare Advantage plan, that you must also be enrolled in a group prescription drug program. So if you are currently enrolled in a direct pay plan, an individual direct pay plan, when you get enrolled into the new MA plan, you will be kicked out of the direct pay program. You will need to, for those members, you will need to complete an ERB and send it over to the Office of Labor Relations so you can pick up your prescription drug coverage. That's an important point.
What's an
Thank you, Diane. I
ERB?
appreciate it.
I apologize. It is the City of New York enrollment application. It is located on OLR's website.
It's called the Health Benefits Program Application and Change Form. That's what you'll find it as.
Okay. So for everyone, I wanted to review through some of the communication pieces that members have received in the mail to date. The first was the notice of change letter, and this is the letter that came from the City of New York that was announcing the change to the Medicare Advantage Plus plan effective January 1st, where the City of New York is going to be automatically enrolling all Medicare eligible retirees and Medicare eligible dependents into the Medicare Advantage Plus plan effective January 1st, 2022. It also outlined the member's ability to opt out to stay in the current plan that you're enrolled in today. Now, following the notice of change letter was the pre-enrollment or the enrollment guide. And the enrollment guides were mailed to retirees based on the plan that you're currently enrolled in today. And they were mailed out in waves. Approximately 30,000 per day were mailed. We started with the senior care population first, and those pre-enrollment guides started to mail on September 7th and completed on September 16th. Now, immediately following the senior care pre-enrollment guides, we started to mail all of the other plan pre-enrollment guides. So all of those guides were mailed completed on September 30th. So if you're covered in another City of New York plan other than senior care, you should be receiving your pre-enrollment guide. Many have received them already, or you'll be receiving it any day now. Now, the pre-enrollment guides are also located on the Office of Labor Relations site, as well as the EmpireBlue.com website that's dedicated to the Medicare Advantage Plus program. So you can view these electronically as well. Now, if you happen to be a senior care member and you have not received your booklet yet, you can call the Welcome Center to get a replacement pre-enrollment guide mailed to your home. And the pre-enrollment guide is a 44-page booklet. So it's a little booklet that came in a plastic envelope, so that just to make sure that you're aware. So if you happen to throw it out, you can get a replacement. Now, in addition to the pre-enrollment guide, which included your opt-out form and opt-out instructions, we also included the frequently asked questions document that's also housed on the Office of Labor Relations site, as well as the side-by-side comparison. Now, after a member becomes effective for January 1st, you'll receive a couple of pieces of information from the new plan. All members will receive a new identification card when you're enrolled in the Medicare Advantage Plus plan. So as I mentioned earlier, we're combining all of those pieces together. So it's going to be one ID card, and that's the identification card that you'll show to doctors and hospitals. And the identification cards are going to be mailed in December. Probably towards the end of December is when you'll receive your new identification card in the mail. We want to ensure that all enrolled members receive their new ID card before the 1st of January. Following your identification card, you'll receive a welcome plan guide. And this guide goes into a little bit more detail about how the programs work and how you can access different benefits. And then we'll continue to communicate with our members throughout the course of 2022 by sending out newsletters to our members on various different topics. Now, members will also have the ability to view online the full evidence of coverage, which is your insurance certificate, and the evidence of coverage will be available online before the end of the opt-out period. We are actually in the final stages of doing legal review with the City of New York. Once that is complete, we will be posting it on the Office of Labor Relations site so that members will have the ability to view the evidence of coverage online before the effective date of the plan. Typically, this document does not become available until after the effective date, after you're a member, but we will be posting it in advance so that members have the ability to see the full certificate. Members will also have the ability to request a paper directory after the 1st of January when you're a member, and they're based on geography. So you will be able to call the customer service line and request a paper directory for the area in which your providers are. And you can ask for more than one area. So if you're a snowbird and you want the provider directory for Queens, New York, while you're here in New York, and you want a provider directory for Sarasota in Florida, when you go down to Florida, you can request both areas, and that will be available to members after January 1st. Now, the enrollment or the opt-out process. As I mentioned earlier, the City of New York will be automatically enrolling all Medicare-eligible retirees and Medicare-eligible dependents into the Medicare Advantage Plus plan for January 1st. This will be automatic, so if you want to go into the Medicare Advantage Plus plan, you do not need to do anything. It will be an automatic process, and you as the member do not need to do anything. However, you have the opportunity to opt out and not go into the new plan if you choose to. And you would need to register your opt-out decision. And the best ways to register your opt-out decision is either over the phone with the Medicare Advantage call center, where the representative can actually log your opt-out decision on your behalf, or you can access the secure link that's located on the empireblue.com website that allows you to electronically register your opt-out decision in a secure manner. You can also mail your opt-out form on the address that's included on the opt-out form, so you can mail that in. You also have the ability to email if you wanted to, but I want to emphasize the most secure way to register your opt-out decision is either over the phone with a representative or through this secure portal that's in the link for the empireblue.com site. And that will ensure that your personal information is sent in a secure and protected fashion. Now, if you choose to opt out, the opt-out period is going to run through October 31st. And this is where I want to emphasize again, we still have plenty of time to make an educated, informed decision in regards to your benefits for 2022. So I want to encourage everyone to really take your time in regards to making this decision. Now, there are some retirees that have sent their opt-out in based on the fact that Memorial Sloan Kettering, they were concerned that they were not in network. They're in network now. So if you want to rescind your opt-out decision, so for those retirees that have already opted out and you want to change your mind and go into the Medicare Advantage Plus plan, you have time to do so. So you can cancel that opt-out decision and you can simply call the call center and let the representatives know that you are changing your mind and you want to rescind your opt-out form. Now, if you choose to opt out, I want to make sure that all retirees understand there could potentially be a buy-up premium that you would be responsible for paying to keep your current plan. Now, the rates for all of the programs are included on the Office of Labor Relations website. So I encourage all retirees to go to the website to look at what the new 2022 premium rates would be for all of the plans that the City of New York offers. Now, specifically for senior care, the buy-up premium for senior care is $191.57 for the base plan and $2.83 for the 365-day hospital rider. So it's a combined total premium of $194.40 per member per month. So if you have a retiree and a covered spouse, that's roughly under $400 a month to opt out to keep the senior care plan. And that buy-up premium of just under $400 will be deducted out of the retiree's pension. So it's a large financial difference. So be mindful and be thoughtful in regards to your decision-making process when you're evaluating all the information. And once again, the rate sheets for all of the plans are included on the Office of Labor Relations site, so you can check the rate sheet to see what your buy-up premium would be if there is a buy-up premium for you to keep the current plan that you're in today. Now, the city is also going to be opening up the fall transfer period on an annual basis. So members will have another opportunity next fall to opt out of the plan if you choose to. So if you go into the Medicare Advantage Plus plan in January and throughout the course of the year, you say, you know, I want to go back to the plan I was originally in last year, you will have the ability to switch back to the plan that you're currently enrolled in today. So members that are in senior care can go into the Medicare Advantage Plus plan and switch back to senior care next fall for 2023. So that will be open next year as well. So you'll have the opportunity to switch back if you choose to. I wanted to leave this slide up just for a few minutes. There's some very important dates and numbers and websites that are a great source of resource for all retirees. Once again, just to confirm, the Medicare Advantage Plus plan will be automatically effective for January 1st, 2022. Retirees will have the ability to opt out if you choose to, and that opt-out period will run until October 31st. So we have the entire month of October. There's also two websites that I wanted to call out. It's the empireblue.com/NYC-MA-plus website, which is our open enrollment website landing page specifically for the City of New York Medicare Advantage Plus plan. And then we also have the Office of Labor Relations website that includes a whole host of information. It has the frequently asked questions document, which is being updated on an ongoing basis. So as new questions have come into the city, they have added it to that frequently asked questions document. It also has the plan comparisons for all of the plans that the City of New York offers, the rate sheets, as well as the ERB or the health benefits application if you want to make some changes. I want to emphasize the fact that the city requires that both the retiree and eligible dependent be with the same carrier. So you cannot have a retiree and a spouse making separate decisions. You come as a package deal. So you both have to make the same decision in regards to your benefit choice for 2022. For those retirees that have a non-Medicare eligible spouse or dependent, they will be enrolled in the GHI CBP plan. So the companion plan that goes along with the Medicare Advantage Plus plan for the Medicare retiree is the GHI CBP plan. So they will continue to have coverage under that GHI CBP plan. I wanted to also reinforce the fact that the Medicare Part B reimbursement that retirees receive through the City of New York will continue. That is not impacted by this change. So you will continue to get your Medicare Part B reimbursement, including your IRMA surcharge. If you're a retiree that has an IRMA surcharge, you will get that reimbursement from the City of New York as well. Jeff mentioned earlier that your union welfare benefit, supplemental benefits are not impacted in any way by the Medicare Advantage Plus program. So you will continue to receive all of the benefits that you receive through the UFT right now. Those are not impacted by this change. Wanted to emphasize the provider network and the fact that this is a national passive PPO program. And that means as a member, you have the ability to see in or out of network providers, and the cost share is going to be the same for you. So whether you see an out of network Medicare participating provider, that cost share will be the same as if it was an in-network contracted provider. So members have the freedom to go in or out of the network and the cost share will be the same. So from the member's perspective, there's no difference. And we pay out-of-network providers the Medicare allowable rate. So those providers will be receiving the same Medicare allowable rate that they're receiving through traditional Medicare today. We are also launching a provider outreach campaign that has been underway since July. And it's an ongoing process. We started with an announcement on the provider portal, and we have since sent out 2 newsletters to all of the providers, as well as e-blasts. We are now ratcheting up the provider education campaign with additional letters, emails, and actual personal telephonic outreach, which has already begun. So we're looking to educate not only the out-of-network providers on how the program works, but we're also looking to make sure that those in-network providers understand how the program works and the fact that they're in the program, and really to let them know that the City of New York plan is changing for January 1st. So this provider education campaign is underway and will continue all the way through the course of the end of the year. We have developed a provider flyer that is a member-friendly provider flyer that can be downloaded and printed. And this is a flyer that you can bring to an out-of-network provider, and it explains to them how the plan works, how they can bill the plan, how they'll get paid the Medicare allowable rate, and it has important information. So members will have the ability, if you're seeing an out-of-network provider, instead of explaining how the program works, you can actually show them that provider flyer. We've also developed a member-facing pre-authorization flyer, and that will be posted on the Office of Labor Relations site as well. Under the Medicare Advantage Plus program, there could be prior authorization that is required for certain services. Not every service requires prior authorization. Some of the common procedures are inpatient hospital stays, complex diagnostic tests like CAT scans, PET scans, MRIs, your therapies like your physical, occupational therapy, infusion therapy, rehab admissions, and also skilled nursing facility admissions. We've included the full list of all services that require prior authorization on a flyer that will also be posted so members can see a full listing of those services. The prior authorization, once again, is handled between the provider and the plan. This is not something that the member has to do. So the providers are the ones that will be coordinating the prior authorization for those services that need prior authorization with the plan. Traditional Medicare looks at claims retrospectively. So they look at the service after it was rendered to make sure that medical necessity guidelines were met. Under the Medicare Advantage Plus plan, we're looking at medical necessity guidelines on the front end so that members don't have any surprises with denied claims. So we know that the medical criteria is met before the service is rendered. So it's really a protection in place to ensure that there's no surprises on behalf of the member. So with that said, I'm going to, before we go into the questions and answers, I'm going to attempt to do the demo for everyone. So we will pull up, and if I can ask, can someone confirm that you can see my screen that has the website on it?
Confirmed.
Okay, great. So this is the dedicated website that I mentioned in the presentation, the NYC-MA Plus. This is the empireblue.com site. This is the link that's located on the Office of Labor Relations site. So once you go to this dedicated website that was set up specifically for the City of New York Medicare Advantage Plus plan, this is the site that houses all of that support information. So you're able to download your enrollment guide. You can also access the list of all of the general informational sessions that we're holding. But in the middle of the page, you'll see right there where it says Find Care. This will bring you to the link that will allow you to search for providers. So when you click on that Find Care, it'll bring you to this provider finder tool. And the way you can search for providers is, let's say we're looking for a very specific provider. I'm looking for a provider in Yonkers, New York. And the doctor that I'm looking for is Eli Goldner. He came up before. Apologize on this. My cursor's not working.
You can put in, Kim, put in show more. If you click on show more, it'll pop up.
There we go.
There you go.
So they're here. So when you go through, you can pick up a specific physician to be able to look for that provider based on the provider's name, first name and last name. And you also have the ability to look for providers. Apologize on this. Oh. I'm going to try to share again. The screen's locking up.
It's the streaming.
Yeah, I think it's because of the bandwidth, because of the number. Well, I'm attempting here. Marlon, do you have the ability to pull up? I can stop sharing. Do you have the ability to pull it up? My screen is frozen.
Give me 1 second. Let me see if I can do it. All right. Share.
Best laid plans.
Let me know if you're able to.
I can see it.
My screen. All right. So let's go to Find Care and see what's going on. All right. So let me know when you're able to see the actual search tool.
Yep, we can see it.
All right. I will put.
Why don't you put Boca Raton, Florida in there?
Boca Raton, Florida.
And then we want to search for hospitals.
Hospitals.
General acute care hospitals. So this allows you to pull up and search general terms. So you can search for all of the various hospitals that are located in the Boca Raton area. So as you can see, Delray Medical Center and all of the other facilities that are located in the Boca Raton area. So members have the ability to use the provider finder tool to do general searches to look for providers based on a geographic area. And you also have the ability to look up specific doctors. So when you look up the specific doctor, you would just put the zip code or the city and state, and then the provider's full first name and last name. So this can be accessed through that dedicated website, and then you'll go to the middle of the page, click on Find Care, and that will bring you to this dedicated Find Care tool. Now, what's incredibly important to remember with the Find Care tool is this is specific for the City of New York Medicare Advantage Plus plan. So this was developed and has loaded all of the providers that participate within this special, unique network. So this network is not available to just any member. This is specific to the City of New York retirees. I want to encourage members, do not look for providers through the BlueCrossBlueShield.com website. Do not look for them through Anthem or Empire or Emblem. You need to really look for the providers through this dedicated, specific website that was set up for the City of New York plan. This website captures all of the Medicare Advantage Plus network providers that are in the plan. And the network tool is updated on a daily basis. So if there's any additional changes or updates, they are fed into the provider finder tool on a daily basis. Now, I just wanted to mention some retirees, when you're searching through the provider search tool, there are some areas in the country, I'll use Delaware or the Maryland, Washington, D.C. area as examples. Both of those areas, while they are a Blue Cross Blue Shield plan, they do not have a group Medicare Advantage program that's loaded into the network sharing. So this doesn't mean that there's no providers for you to access in those areas. It means that they may not come up on the search tool because they do not have a group Medicare Advantage PPO network that's loaded into this. So don't think that there's no providers for you to choose from. As long as they're a Blue Cross Blue Shield provider in that area, they're going to be accepting the plan. Many of the areas we're working with, the local Blues plans. So the Maryland, DC area will be working with our Blues partner, Care First, and they will be doing outreach to all of their providers as well, so that they understand the City of New York retirees that live in that area will have in-network access with those providers. So I just wanted to make sure that for those individuals in certain areas, you know, as Michael Mulgrew mentioned earlier, there's also some areas that are very rural that may not have network providers that are located close by. So you will have access to any Medicare participating provider. So you're not bound by in-network providers only, but this is a good tool to give a little peace of mind to ensure that the current doctors you're seeing today, yes, are in fact in the plan. So
Kim, I did want to call out one thing that I've seen a lot of members doing, retirees, that they're putting doctor in front of the name, and then you'll get this it will pop up. You know, they won't be able to find it. So that's critical. Just make sure that you just put the first and last name, and then the doctor will come up.
Great. Thank you, Marlon. Well, at this time, I want to thank everyone for your time. I'm going to turn it back over to Tom and Vinny to go through the questions and answer session, and me and the team will be more than happy to answer as many questions as we possibly can.
Kim, thank you very much. I mean, that was so informative that I'm just texting Vinny and Debbie back and forth that it seems like you've answered most questions. I know, looking at the clock, that we were going to have Vinny go through the website, but I'm just going to mention right now the new website where we have so much of this information. I'll do it quickly. It's a dedicated page. Just go to uft.org/retirees or go to uft.org, look for chapters, and you can access it there. So I'm going to turn it over to Vinny. Vinny's going to exercise some judgment along with Joyce and Gloria to see which questions have not been answered and what we can do to make sure we get the most answers. I have to say that we had 7,800 people on. It's beginning to dwindle because I think people have gotten good information. We still have 7,400. So Vince, I'm going to turn it over to you, and you decide how you're going to handle it with Gloria and with Joyce. Go ahead, Vinny.
Thank you, Tom, and welcome to all the members who are online with us. I especially want to thank the Health Care Committee members from around the metropolitan area and around the country for the questions that they submitted. As you just said, Tom, Kim pretty much covered most of the questions we had. Another great presentation. I just wanted to make one comment about the committee. A lot of people think that we're just shills for the plan. In fact, our members are really representative of the entire membership. We're self-nominated. We're diverse in every demographic category. And the truth is that we share the same concerns, issues, doubts about whether the plan works for us, as do many of you listening in today. I'm going to ask Joyce and Gloria to do the following. I'm going to ask you, please, to look through your questions, and anything that Kim has already answered, I will ask you, please, to omit those questions. We don't have a lot of time left, and therefore a little bit of judicious questioning would be appropriate. The only other thing that I do want to say is that we now have a newly created dedicated webpage on the UFT retiree website, which has a ton of links, and we will add some of the links that Kim showed to us today. You see a picture of it on screen right now. The trick to use the website is to put into the web address box at the top of your web browser, uft.org/retirees. And when you do, you'll wind up on this page, and then all you have to do is click the green box on top of Tom Murphy's head. And that will open up an entire page. And make sure that you don't just stop at the top. Go all the way through it, because it's loaded with lots of links that are helpful to everyone. So with that, and with a word to Kim to say thank you for really a superb presentation today, I'm going to hand it over to Joyce. And Joyce, I ask you to judiciously go through your questions.
Good afternoon, brothers and sisters. I'm Joyce Magnus. And Kim, that was so super comprehensive that my time is now down to about 2 seconds. However, I do have a few questions here that we just, even if you did answer, I'd like to hear it again. Could you tell us how you evaluate the success of your outreach program?
You know, I say that our provider outreach is an ever-evolving process, because we started outreach to providers all the way back in July, and what became very evident to us is providers and their offices, they're not reading the portal, they're not reading the newsletters. So, and we knew that we would have to do additional outreach, and that's why we're really vamping up that outreach. And we've already started personal meetings with the largest provider practices in New York. So they're meeting face to face, and we are doing the telephonic outreach campaign. So all of this outreach is going to be continued through the course of the year. But I tell you, the month of October, there is going to be every single provider is going to be receiving a phone call to ensure that the providers are educated on program. The most important thing is the providers need to know that the City of New York plan is changing to the City of New York Medicare Advantage Plus plan, and that 90% of these docs are in the network. So that's what we're working on right now. So I measure success when the noise stops.
Thank you very much. When there is an issue with someone outside of New York, that 833 phone number that you quoted, if we call in and speak to someone there saying we're having a disconnect between service and this provider, will you follow up and call and explain it so that the member can have an in-network person helping?
Yes, we want to take the member out of the middle. So that's where the concierge health guide is in place to help take the member out of the middle. So if a member has a situation where a provider needs to be educated on how the plan works, how they submit claims, they should call the concierge member service line, give us the name and phone number of that provider, and we will do the outreach directly to that provider on behalf of the member. So they can call us and we'll intervene and we'll do the legwork for them.
I have one final question for you. Do you anticipate being able to reach out to all the providers by October 31st?
The goal is we are going to be outreaching to providers based on the number of members. So it's most important that we go from the top down. So we want to capture those providers that are seeing the most amount of members right now. So they're in tiers. So those are the docs that we're reaching out to first. Our ultimate goal is to be able to outreach and communicate with every single provider that has seen a City of New York member, so that every single provider has been communicated to. That's not to say that we're going to be able to succeed in making actual contact with every single physician's office, but the attempts will be made and the continued outreach will continue through November and December. So there'll be multiple attempts that will be made to outreach to those providers. So our goal is to get to as many as we can before the end of October, knowing that we may not be able to connect with every provider if their office is closed. But we will eventually get to everybody.
This outreach to providers is also ongoing to geographical places where our retirees are, but they're not in the metropolitan area. For example, Florida or Las Vegas, actually Nevada, and places like that.
They're included. So those out-of-state providers, this is a national provider outreach campaign. It is not just tied to the New York City metropolitan area. This encompasses all of the 50 states.
Thank you. Thank you very much. Vince? I'm covered.
To give you a break, Kim, I have a couple of questions to ask of Diane.
Vinny, Gloria has to leave in a couple of minutes. Do you think we
Okay.
can ask her first and then come back to those?
Thanks, Tom. Okay, Gloria, your turn.
Just a few. You're muted, Gloria. Have to unmute.
Yes, good afternoon to all. Thank you, Michael, Tom, Jeff, Vinny, and Kim. Thank you very much for that very extensive presentation. I'm really jumping to, I think, the most relevant question on here. You pretty much answered them all, as was said before. The question says, Medicare allows you to try Medicare Advantage without losing your access to Medigap. This is known as the Medicare Advantage trial period or the Medicare right to try. During this time, you can buy a Medicare Advantage plan and keep it for up to 1 year. If you leave the plan during that year, you'll be able to buy a Medigap plan without medical underwriting. You don't have to worry about being denied a Medigap policy or being charged a high rate. You can also return to the original Medicare, and depending on which Medicare Advantage plan you had, may be able to purchase a Medicare Part D. Where can we find supporting documentation on this, Kim?
The information that you just cited is relative to the individual marketplace. So I want retirees to understand the benefit program that you have today is not an individual Medigap plan. It is a group-sponsored plan through the city of New York. So there is no underwriting or pre-existing condition period that you have to worry about. Now, the guidelines in regards to the free trial, that's for individuals. So those are people who go into the individual Medicare Advantage plan and have the ability to purchase an individual Medigap plan. I encourage retirees to look on the it's the site for the Health and Human Services. So it's HHS site. That has information that talks about the fact that it does not apply to group-sponsored programs. So that's where the information is housed. So retirees will have the ability to go back to senior care plan next year if they choose to. But what you just cited was individual guidelines for the individual marketplace.
Okay, thank you, Kim. Another question is, Empire and Emblem now claim that Advantage Plus is a 4-star Medicare program. Medicare has not rated at all yet because Medicare doesn't have all the information. So the question is, when will this be rated? You know, where do they find that rating?
Yeah, the 4-star rating is actually the rating for 2021. So the plan, the New York City Medicare Advantage Plus plan is a 4-star plan for 2021. And the star flyer is included in the pre-enrollment guide. So members have that in their pre-enrollment guide. It's towards the end. CMS is actually going to be announcing the 2022 star ratings in October. So we'll be able to share the updated star ratings with everyone before the end of the opt-out period. So you'll know what the plan is rated for 2022.
Okay. And I know you mentioned the reach out program you're doing. So will doctors who are telling retirees that it's too much paperwork, that will be addressed when you do this reach out program to doctors as part of the education you're giving the doctors?
Yes, and there is some extra steps that some providers may take in regards to the pre-authorization process. So there could be an extra step, but we address that with the providers during the outreach campaign as well.
Okay, all right. And any pre-existing or continuing treatment crosses over into January 2022. What do individuals need to do so they prevent interruption of service?
Now, this is really important. So for any members that are in the midst of treatment right now, so maybe there's a member in December who's in the middle of cancer treatment. We need to make sure that we know who that member is so that we can get them engaged with our care management and case management teams so that they can help coordinate and work with the providers. For any member that's in the middle of a treatment, I encourage you to remind your doctor that your insurance is changing. January 1st of 2022 is step 1. Step 2 is to contact our concierge health guideline to let us know that you're in the midst of treatment and that we can engage you with the clinical team. So those are the 2 steps that I encourage. The goal here is we want to make sure that there's continuity of care and continuity of services. No member is going to have an issue where there's a gap in their care treatment. But this is where it's really important. We don't know who you are. That's why it's important for you to let us know and also make sure your providers know what they need to do. So make sure your providers are aware of your plan is changing January 1st. This way, everyone starts the conversation early in the process.
I thank you so much, Kim. As a very recently new retiree, I want to thank you for all you're doing and everyone that's involved in this process is doing. Thank you very much. Back to Vinny.
Thank you, Gloria. And I have just a couple of questions. The first one for I think the first 2 for Diane. Diane, are you there?
Yes, I am.
Okay, listen. For the people who have senior care, who want to opt out. Many are asking the question, besides the premium, we'll also be paying a 20% copay. What are the Medicare guidelines pertaining to that issue?
As far as Medicare is concerned, Medicare does allow co-payments on the group-sponsored programs.
We're sort of losing you, Diane.
I know, I'm trying to figure out why.
Diane, if you can, stop your video. You probably lost, stop your video. Just use your audio.
Can you hear me?
Yep.
Okay. I think it was my internet. I apologize. As I was saying, is that Medicare guidelines allow group-sponsored programs to implement co-payments. So as Michael mentioned in the beginning of the presentation, is that this was something that was going to be implemented in early 2021, but due to COVID, they pushed that off to now 2022. So this was already in the works.
Okay, a couple of questions, especially with members and spouses. A member who opts out has a spouse who's also 65 and older. Must they also file an individual opt-out form?
Yes. We ask that the member, as well as their spouse, their dependent, complete an opt-out form.
Now, what about a member who opts out and has a spouse who turns 65 next year? Does that spouse also need an individual opt-out form?
No, because what happens is that the dependent follows the retiree. So if the retiree is chosen to opt out of the MA plan and remain in the senior care plan, when the spouse turns age 65 in 2022, they will be automatically enrolled into the senior care program.
Okay. The last question for you. Will non-Medicare members in other plans, for example, HIP or Aetna, etc., be able to stay in the senior portion of that plan moving forward?
When you say senior portion, what are you referring to?
For example, HIP has HIP VIP.
Yes. So okay, repeat the question then. I apologize.
So will, for example, will a non-Medicare member in HIP who has HIP now, when they become Medicare eligible, will they be able to move into the HIP VIP?
So as of 2022, the city of New York has stated that all under 65 retirees that are aging into the program, they will age into the Medicare Advantage program. If they like, they can opt out and they can enroll in the senior care program, but the HIP VIP program will not be available to them. Now, if back to your original statement, if you have a split contract and the HIP VIP, the retiree is already in HIP VIP and the dependent is aging in, that dependent can age into the HIP VIP plan.
Okay, and finally, I have a question for Marlon. Just one. You there, Marlon?
I'm here. I turn off the video just in case.
Okay. If a member has to have tests, such as an MRI done immediately prior to surgery, do the authorizations still apply, or like in an emergency room?
Well, prior authorizations does not apply in an emergency situation. Now, if it's urgent and it's not an emergency, there is an expedited process in place that we have to approve services within 24, 48 hours. We work directly with the provider to ensure that we minimize any delays in the services that the member may need. So also from a prior authorization timeline perspective, our standard average, because this question does come up, so I want to share a little bit more information on this. CMS requires prior authorizations to be processed within 14 days. Our standard prior authorization timeframes are within 6 to 7 days. So we beat it by half of what the requirements. But rest assured, if it's an emergency, you don't need a prior authorization. And if it's urgent, we work within 24 to 48 hours.
And last question is, could transfers between plans be refused based on pre-existing conditions?
To answer that, no. Members cannot be refused due to pre-existing conditions. So a member will be able to have the ability to switch back and forth during the fall transfer period without any issues.
Thank you, Marlon. Thank you, Diane and Tom. It's back in your hands at 3:43.
Well, thank you, Vinny, and thank you, everybody. And I'm just looking that we still have 6,000 people with us. We had a high of 7,800. Thank you, 6,000, for staying with us. Thank you, Kim, and your colleagues. And I think that Gloria and Joyce and Vinny did a bang-up job, and most of the questions were answered. And what we did was we collected these questions from everybody. We didn't just like dew on the grass. We got these from everybody. We tried to incorporate everything we possibly could. Please note that October 13th at 1 p.m., our RTC General Membership meeting will be held. Kim has graciously agreed to come back. We want to clean this up with any information that people still have questions about or need more information. So I want to thank everybody for being on this, and I hope to see virtually many of you on October 13th. So thank you and goodbye.
Thank you.